Hi guys, this is Dr. Schuler here, putting together a series on splinting, casting, mostly just splinting. We're going to go through first the basic terminology that you're going to hear from the providers, just so you have some basic knowledge, and this is by no means all-inclusive, and you're still going to have some questions, but we'll go through these first terms, and then we'll go on to putting the cast or splint together. First thing I want to do is go through the bones that we most commonly are splinting, and we'll start with the arm. In the arm, the main two bones that you're going to be seeing the most of is the radius and the ulna, also the humerus. Radius is on the thumb side, the ulna is on the pinky side, and the humerus up here. Now often we're going to be having humeral fractures up at this shoulder area, but it's still the humerus that we're going to be talking about. And we'll talk to you guys about looking at the x-rays with the providers, just so you guys know exactly what you're splinting. On the lower extremity, the main bone bears most weight is the tibia, and then on the outside is the fibula. We also have the femur, big bone here. Weight-bearing bone again is the tibia and the femur. Non-weight-bearing on the outside or lateral side is the fibula. There's 28 bones in the foot, 28 bones in the hand. They correlate. We don't need to go through all of those. There are the main bones of the fingers. There's three sets: phalanges, distal, medial, middle, and proximal. Same way with the toes. So those are the bones that we'll typically see and talk about. We'll go through the terminology now. Most commonly we'll use terms like proximal and distal. Proximal is basically closer to the heart. So this is the more proximal side of the upper extremity. This is the more distal side. Proximal, distal. Proximal, distal. Again, proximal, distal. Anything further away is more distal. We'll talk about dorsal versus volar. This is the volar side. This is the dorsal side. Okay? On the hand, we actually can get more specific and say this is the palmar aspect and this is the dorsal aspect. On the foot, we go through plantar aspect, plantar, and dorsal. Again, dorsal, plantar. We also talk about positioning. Some of the positioning that we'll ask, most commonly, it will be neutral position. We want most splints in a neutral position. Neutral position on the lower extremity, on the foot, is with the foot basically in a 90-degree angle in relationship to the femur, okay? So sometimes when we're splinting the lower leg, we want the foot in a 90-degree angle, and it helps with a lot of things that we'll go over a bit later. But that's neutral position for the foot. For the hand, neutral position is basically straight up, okay? It follows the same linear pattern as the arm. Basically, it continues on. This would be a flexed position, and this is an extended position. Extended, flexed at the elbow. Same way down here. In this case, the provider might say something like plantar flexed. Plantar flexed is pushed down, pushing on the gas pedal. Dorsiflexed is pulled up. Plantar flexed, dorsiflexed. We often will have the knee in a slightly flexed position. This is flexed, this is extended with the knee. Okay? There's some rotational movements that we might also express to you guys. This is supinated. This is the supinated position, and this is a pronated position. Same way with the foot. This is pronated, this is supinated. We don't often use those terms very much with splinting, but they might come up. On the more proximal portion of the extremities, we can talk about abduction and adduction. Abduction with a B, abduction, sometimes we even call it abduction, is extending the extremity out, and adduction is bringing the extremity in. That could come in useful when you're putting a sling or a shoulder immobilizer. We'll talk about that later. In regards to abduction and adduction in the lower extremity, again, this is adduction, this is abduction, abduction, adduction. And I mentioned already the bones, and we actually refer to a position, especially on that arm or upper extremity. This is the radial side of the arm, this is the ulnar side. It just refers to the bones underneath that side. I think right now that's, no, there's one more. We have lateral and medial, and we will bring those up. So the medial side of an extremity on the inside, the lateral is the outside of the extremity. Usually we don't refer to medial and lateral on the upper extremities, but we might do that, and that would be most commonly the medial side is the radial side and the lateral side is the ulnar side. Okay, lateral is on the outside and medial is on the inside. All right, we'll go from there.